But we begin with breaking news. The FDA's advisory panel votes to recommend the Pfizer vaccine for emergency use in children ages 5 to 11. The committee of outside experts voted in favor of the vaccine after meeting and debating the issue for pretty much most of the day.
Now, in the end, 17 members voted yes. There was one abstention, but that decision came after a meeting that was filled with a lot of tough questions and passionate debate. We bring in our Dr. Frank George, who's been following this very pivotal gathering since early this morning. Frank, this one, aside from the fact that the finding was released late in the afternoon, or the vote was late in the afternoon, this was a different kind of meeting.
Yeah, definitely, Kim and Evan. You know, we expected a vigorous debate because the risk-benefit equation is different when you're talking about children. But we've also learned some members of the committee were the focus of a coordinated email attack over the weekend by parents opposing the vaccine. The FDA's Dr. Peter Marks actually started the meeting by saying there are passionate feelings about this vaccine on both sides.
I want to acknowledge the fact that there are strong feelings that have clearly been expressed by members of the public, both for and against the use of the Pfizer-BioNTech vaccine under emergency use authorization for this age group.
At the center of the debate, how to balance the benefits against the risks. While the risk from COVID is much lower for children, cases are climbing and there have been hospitalizations and deaths.
Between January 1st, 2020 and October 16th, 2021, there were 94 COVID-19 associated deaths reported among children 5 to 11 years of age.
More than 5,200 children have also been diagnosed with MIS-C, a serious multi-system inflammatory syndrome. But the panel of outside experts was concerned about the risk of myocarditis, especially in males.
This is the principal concern that people have regarding use of these mRNA vaccines in children.
The CDC presented several models that showed the benefits of the vaccine outweighed the risk of myocarditis, except when COVID cases fell very low. Some panelists argued in support of the vaccine.
To me, the question is pretty clear. We don't want children to be dying of COVID, even if it is far fewer children than adults, and we don't want them in the ICU.
Others voiced the fear of some parents when it comes to choice.
I'm just worried that if we say yes, that the states are going to mandate administration of this vaccine to children in order to go to school, and I do not agree with that.
Now, the root of the problem is we will never know the true risk of rare side effects in this group unless the vaccine is made widely available. And the panel had to weigh that versus the known risks of COVID to this particular age group. Now, ahead at 6, we'll dig a little deeper into the myocarditis risk and explain why it is so hard to calculate specifically in this age group.
Frank, this was just step one, the decision of this panel. So take us through what's next with this vaccine for this age group.
Well, the FDA is now going to officially decide whether or not to issue emergency use authorization for Pfizer's pediatric vaccine. If the FDA does, it will then go to the CDC's advisory panel on November 2nd and 3rd. Now, they could decide to limit the use of the vaccine to certain groups of kids, like those who are at high risk, or just make it available to everyone. The CDC director would then have the final say after that.
We'll be on it. All right, Frank, thanks.